Ready to transform your hairline? Discover the secrets of hair transplant today in this video, in which we are going to discuss a grade 3 patient who was suffering from male pattern baldness and how a hair transplant changed his life. Also in this video, we are going to discuss about our app, the AI app, which predicts your results and what kind of results you can get after hair transplant. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon. So this 25-year-old male came to us with a history of 2 to 3 years of hair fall and hair loss. He had not taken any medicines to prevent this, and he had lost a significant number of hairs in the front. His hairline had receded and there was some thinning in the crown, but which looked like it could respond to medical treatment. So we planned out a hair transplant for him. The planning of hair transplant was based on doing his trichoscopy, and in his trichoscopy we found out that his density was suboptimal. It was around 76 follicular units per centimeter square. His total surface area of the donor site was around 130 centimeter square. So he had approximately 9,800 to 9,900 follicular units available in his donor site, and these hairs were thick. The average thickness was 0.072 millimeter in this case. So considering these facts, we discussed these findings with him and planned out his hair transplant surgery. Please like the video if you like the scientific way in which we plan each and every hair transplant of ours. Now what we did was to measure his recipient area after marking his hairline. So this hairline we marked at 7 centimeter from the midpoint of the eyebrows, and this was gently curving towards the side, and we made this hairline irregular, and we used a laser hairline device to make it more symmetric so that it doesn't look very weird. Then we calculated the surface area of the recipient area. It was around 85 centimeters square, and we planned a density of around 35 follicular units per centimeter square in this area. So the requirement in this case was 3000 grafts approximately. Then we started with the procedure, the steps of which were after marking the hairline, we started giving him local anesthesia, and then after giving the local anesthesia all around, we started with the slit making. So the slit making or the site creation is making gaps, very tiny gap into the recipient area or the bald area where the grafts have to be inserted. Then we turned the position of the patient and started with the FUE graft extraction, which is a 1-by-1 graft extraction from the donor site. After the extraction part, the grafts are collected. Then after the collection of the grafts are sorted into 1, 2, 3, 4 hair grafts, and this is done under magnification device. And after this, our team starts with the insertion of the grafts into the sites which we have created. If you are also planning a hair transplant for yourself or your family members or your friends, you can either call us at the numbers mentioned on the screen, or you can WhatsApp us your pictures with your basic information and your history of any medical problem or history of your hair loss, and then our team will try to reach out to you. Apart from this, you can also mention about your problem in the comment section below. So after this, the patient was in continuous touch with us. He came for the first shampoo after 2 to 3 days, and for the cleaning up of the transplanted hairs, removal of the scab at around 10 to 12 days. And then 3rd month onward, he used to come for the PRPs regularly. At 3 to 4 months, the growth was not very significant, as is very usual. And you can see how his hair transplant has turned out at around 8 months. And you can also see the combing video, and this is not the final result. The final results are generally seen at 1 year and above. And here you can see the results at 9 months after his hair transplant, which look very natural. And please remember that the hairline has to look a bit soft, and that's the reason we use single hair grafts in the hairline. And here we can see that the similar kind of results are seen in this patient's result at 9 months. Still, there is some more hairs to grow. Please subscribe to our channel to see and watch more of these useful videos where a lot of scientific facts are discussed about each and every individual case. Now coming to our artificial intelligence app, it's by the name of Saraswat Hospital App, and it is available on iOS as well as Android App Store, and it's totally free of cost. You just have to download it, fill some information, and predicted results, you will get a peek into them after a customized input from the ABHRS doctor in our center as well. So this gives you a peek into the results, also tells you about the number of grafts roughly which you will need in your case, and few important points you should be discussing with your hair transplant doctor. doctors. So you can download it from the app stores. It is absolutely free. Before we close this video, I want you to take home some very important points or messages through this video which I want to convey with you when you are choosing a hair transplant doctor or a clinic for your hair transplant. Number one is the credentials of the doctor. The highest certification body in the world is ABHRS, which is American Board of Hair Restoration Surgery. Apart from this, the clinic which is going to perform, or the doctors, just check out how they are maintaining the transparency of the graft. Is it something they are showing on the machine, or what's the way in which the transparency is maintained? Because the costing of the hair transplant goes by the number of grafts. Third important thing is the team. The entire team should be a permanent team. They should not be for hire. Every clinic should be having their permanent team, which is where the team is discussing each and every case individually. The doctor briefs them about each and every case. Apart from this, please check how the doctor is planning your hair transplant. Is he spending some time with you in discussing your case, discussing your trichoscopy report in detail with you, or just looking at your head and saying 2000 to 2500, 3000 or 4000 grafts are required in your case? So these are the points you should be discussing and looking out for in a hair transplant clinic before choosing your hair transplant doctor. If you find this video useful, I request you to share this with your friends or family members, whosoever is planning a hair transplant for themselves. If you want to know more about our hair transplant app, the AI-based app, please click the video on the left. And if you want to see one of our latest hair transplant video or patients whose video we have uploaded on the channel, please click the video on the right.